Welcome in. All right, let's go ahead and shut the door behind you. Hey everyone, I'm Dr. Ben. This is my office and welcome to it. Over here is our reception area. Typically, my patients will come in and kind of check in on the computer over here where they just log in their information. The system lets me know when they're in here, so that way I can come out and bring them to the room that they need to. Go ahead and follow me. This area is our kind of reception scene area, so if any patients are waiting, they just wait over here until they're called. All right. We have a computer viewing screen over here as well, just to kind of provide some patient's education. So things that you normally see in a chiropractic office, we try to keep it more kind of tech savvy. That way it's kind of automated. It's just like videos and slides that patients can view. All right. And then over here is kind of our rehab area. Okay, we do have equipment that we use a lot, as well as the basic tools we need for some basic vitals. Okay. Over here is room 1. This is our new patient examination room. Typically, new patients, after they fill out paperwork, will come into this room where we'll ask them to get changed into gowns. So that way we can do both a foot scan and spinal screening on the base level, and then we also do a functional screen. All right. And this is where all our new patients come in after the initial visit and for any re-examinations and for future visits. All right. And then we have 2 more rooms down this hallway over here. Both of these are our treatment rooms. All right. I mainly use room 3, but all the rooms are shared between the two other chiros that also work here. Both rooms are nearly identical in terms of equipment. Both there's a flexion distraction table, as well as a variable frequency adjuster or soft pro adjuster equipment. All right. Bathrooms are over here. In the back, we have some equipment that we use for patients, as well as storage for some of the equipment that we have. Okay, come on in this room. This is my primary office where I usually treat my patients. Okay, there's a skeleton we call Sam, so it's useful for patient educational purposes. The rest of the room, I have various kind of displays to kind of help patients understand the human body, especially the muscular, nervous system, and skeletal system. Okay. Both rooms, treatment rooms, you'll see a lot of computers. One is typically used for the electronic health record system. The other one is the soft pro adjuster system. And they also double as patient education, where we can just pull up things such like this little feature I like to use with the pro adjuster, which is their Visual Odyssey automated, and it's very interactive, so patients can love playing with this. All right, and this is kind of a basic tour of office layout.